Today we are discussing about femoral fixation options in ACL surgery. Now I would be demonstrating you 8 different types of femoral fixation buttons that have been developed by Osteocare. I can say that probably they have the largest range of the femoral buttons that are available in the market at present, and which suits to the needs of most of the surgeon and most of the graft options that you may consider. Now, different surgeons have different perspectives. Some surgeons are believers of continuous loop or a fixed loop fixation. Some surgeons are believers of a variable loop or an adjustable loop. So basically they have an option of a fixed loop construct, a variable loop construct, and now there is a new loop which has come into the market, and that is a novel patented product, and that is called as an EcoButton Flex. Besides that, you all may be knowing that internal brace is a thing which is into the market, and there are surgeons who are believers of internal brace and there are surgeons who are not the believers of internal brace. So with all the options they have an option of brace in all the buttons which are there. So let's start with the most basic thing or the most basic technology, and that is basically the fixed loop buttons. So if you see here, this is the most basic button that is available. This is called as a fixed loop button. So this button is available in different sizes. So they are available in 15, 20 and 25 millimeters. If you are using this particular button, you need to have a very good calculation on the femoral socket. And a very simple formula that I usually teach to my fellows is, supposedly if you have a tunnel length which is more than 35, I use a 20 mm button. If you have a tunnel length which is less than 35, I will use a 15 mm button. And I would subtract 8 from the tunnel size to actually get the length of the socket. So supposedly you get a 38 millimeter tunnel on the femur. So then if you are using a 20 mm button, you subtract 13 from 38, so that makes 25. So you have to drill your socket up to 25. If you are using a 15 millimeter button, in the same scenario you have to subtract 8. So you have to subtract 8 from 38 and that becomes 30. So you have to drill your socket up to 30 millimeters. Okay, so this is the basic calculation that you need to do for your fixed loop button. So this is the first and this is the prototype of all the ACL fixation, and this is called as a fixed loop EcoButton. Now the second variation that we have is a EcoButton, fixed loop EcoButton with a brace. So this is a unique product which is not available with other competitor companies. So this is a fixed loop button and we have a brace which is integrated into the button itself. So what you can appreciate here is that the brace will go into the button itself. So the brace is going inside the button itself. So that gives the brace a very strong hold. So those who are believers of internal brace, the internal brace can be put in two ways. You can put the brace into the button per se, or sometimes the people are putting the brace into the loop. So if you put in the button, it is better because it will take care of the full length. If you put it in button, if the button loosens out, this brace also loses its function. So better you put it into the button itself, and here it is assembled in the factory itself. So you have a very perfect position of the brace that you can appreciate here. So this is a very good innovation, that is a fixed loop button along with the brace. So this is about the fixed loop surgeons. Now the second group of surgeons, typically what I see is more youngsters, is the adjustable loop surgeons. So this is what is called as a knotless rope. So this is basically an adjustable loop. So here there is only one size button that fits all. So you have to have only one button for all the sizes. So this is an adjustable loop, and you have two loops. So the black loop and the green loop. This is for flipping, and this is better as compared to the other companies, because these both loop you can have a flipping feeling, which is very important in some cases. Here the loop length is adequate, and the cinching of the loop can be performed very securely. Okay, so this is an adjustable loop. So the tunnel calculation in adjustable loop is pretty easy. You just have to calculate the amount of graft that you want to put into the tunnel, and this is the amount of socket you have to place. So normally as per the surgeon's preference, you can put around 15 mm or 20 mm of the graft into the socket. So you need to drill the socket accordingly. So whatever the length of the tunnel, doesn't matter, you have to drill the socket either 15 millimeters or 20 millimeters as per your wish. The most important thing here is to mark the button up till the length of the graft. So supposedly your tunnel is like 38 millimeters. So you can just mark your loop at 38 millimeters with a marker. So Osteocare provides the button with the marker and the scale. So you can do that step in that stage only. So supposedly your loop length is 38 millimeters as was the case. So you can just put the scale right here and you can mark your button at 38 millimeters so that you know where you have to stop when you are pulling on the femoral side. The only complication or only problem that may occur in an adjustable loop button can be if you pull it very hard, it may come out more and it may be resting on the tensor fascia. So you have to be very gradual in pulling this adjustable button as compared to a fixed loop button. So be very gradual. There are two techniques. One is the marking of the button loop, that will help. That is number one. The second thing is you can go on to the medial portal and you can see the actual flip of the button from inside the tunnel. That is the second technique. And the third technique, sometimes what I do is I look from the joint and go towards the gutters, and I actually flip the button under vision. That is the third technique, and you can see our video on this adjustable button flipping under vision, which is on the YouTube. So that is also one thing that you can see. Now, adjustable loop button was actually described with the use of internal brace. So the company now has a button which is integrated into the knotless rope. So this knotless rope is a similar knotless rope, but that is integrated into the loop itself. So if you see the design, now this design is a very innovative design. The button itself has the brace inside. You can see that. So the brace is actually integrated into the button loop itself. So you can see that the brace is integrated into the button loop itself, and this gives you a very good hold, and you don't have to prepare it intra-op, and this brace fixation is very good. So you can use this option if you are a believer of internal brace with an adjustable loop. So this is an option, and both of these two options are also very good if you are planning to do something like an all inside ACL surgery or all inside equivalent ACL surgery. So you can use these both buttons very carefully in this. Whenever I am using an internal brace, whenever I am doing an all inside equivalent surgery, I would rather use an tape, because the internal brace tape will give you a phenomenon of seat belt phenomenon type of effect, and it protects the graft against re-tears, and you can also rehab your patients faster. So you can use this adjustable loop with the brace. Now, so there are believers of continuous loop and there are believers of adjustable loop, but Osteocare has come up with a unique concept of a hybrid loop which has features of both a fixed loop as well as an adjustable loop. So these are basically loops which are fixed in the length, but they have the micro adjustability features added to them. So what that means is that their loop of 20 millimeters, you can see that this loop is 20 millimeters. But there is a cinching loop inside. So you can see that this is a cinching loop which is there, and this loop can be cinched like this, if you can see here. And when I cinch this loop, this button will shorten, and the 20 mm button has now become 15 millimeter button. So it has about 5 millimeters of micro adjustability. So the tensioning you can do inspired by design, by principle, by surgical technique. You will do a surgery which is equivalent to a fixed loop. Still you have that micro adjustability. If you want to tension your graft in the end, or before that, if you want to fill that extra void into your socket, you can fill it up with this kind of a Eco Button Flex technology. And this technology also they have with a brace. So you have all the features which you see in fixed loop, adjustable loop, and the internal bracing if you want. So you have a Eco Button Flex with an internal brace option also available. So you have a fixed loop button with micro adjustability, with a tape. So you can actually take care of all the modalities or all the principles of femoral ACL sided fixation. Now these are the basic tools that you want to use with your soft tissue graft. So if you are using a semitendinosus, peroneus tendon, then these are the techniques. Now a recent innovation has been made in the field of a quadriceps tendon, or if you are not using a fixed using a soft tissue graft. So if you are using a graft which is like a hard graft, like a quadriceps graft and BTB graft, so there are femoral button options which are available for quadriceps. So this is a quadriceps ACL button, and this is a BTB ACL button. So these both are recent innovations by Osteocare, in which there is a loop. So here in this particular case, this is basically a Eco Button Flex fixed loop button with a micro adjustability, and then we have an option of quadriceps fixation, and quadriceps fixation is usually made in a Krakow fashion. So this is basically the strip of a broad tape which is there, and you will usually put your quadriceps graft somewhere around here like this, okay, like this, and then with this needle you will be preparing the quadriceps graft. We have uploaded a video on the tendon preparation of quadriceps graft using this particular technique, and you can see it on the YouTube. But this will give you a very good fixation for femoral side for a quadriceps graft if you are using a soft tissue quadriceps graft. So you can prepare it very nicely with this straight needle, and you can use a Krakow style loops to repair this sort of a quadriceps tendon. Similar, we have a button which is for BTB fixation. So here you can see that there is the loop is here, and this loop comes with a needle, and which can be used for the preparation of BTB graft. And we have a specific video available on the YouTube for the BTB graft fixation also. So you can see that whether you are using a soft tissue graft like a SEMI-T or a peroneus tendon, or whether you are using a more stiffer graft like quadriceps, soft tissue, or BTB with bone, Osteocare has all the kinds of buttons which are available, which suits your interest and which suits your principle. So whether you are a believer of internal brace, whether you are not a believer of internal brace, whether you like a fixed loop button, whether you like an adjustable loop button, whether you need the advantages of both fixed loop and adjustable loop, without having disadvantages of both, you can use a hybrid loop with them. So basically they have the largest range of the buttons which are available at present in market as compared to any other company, and I would recommend you to contact us if you need any more information regarding the ACL femoral sided button fixations. Thank you.